Hi everyone, my name is Dinesh Sirasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I'm trying to share with you some of the things I've learned along the way. Today we're going to be talking about imaging the long head of biceps tendon. There are a couple of resources that I fully recommend you having a look at. First of all, there's the ultrasound cases info, which provides a lot of different images and different types of pathologies that you might see. In terms of your imaging, using the ESSR guidelines is invaluable, and I would really recommend that to anyone from the beginner to the more advanced practitioner. Here's an image taken from the ESSR guidelines. On the left, you can see the image of the patient who is sitting upright, the elbow is tucked against the side, and the hand is in a supinated position. On the right, you can see the ultrasound images, and what you're looking for here is for the long head of biceps to be situated between the lesser and greater tuberosities. On the left here, you see a similar positioning to the ESSR guidelines, with the subject upright and the hand in a supinated position with the transducer across the biceps tendon. An alternative is to have the subject lying on the examination couch in a supine position. There's two benefits to this. One, the subject, if they're having pain, is much more comfortable because they're not having to support the arm. And also, as the examiner, you're a little bit more stable and a little bit more control to obtain a much clearer image. In the supine position, you can also turn the transducer into a long axis view, and it allows you to see the long head of biceps in the long axis. Here we can see some images of the long head of biceps tendon in the short axis. You may notice that there are some differences in the images, and while the biceps tendon is situated in the bicipital groove in all three, the quality and the clarity of the images varies. And this is predominantly due to the machine that was used in undertaking the scans. Remember, when scanning the biceps tendon in the short axis, it is important to scan down to the insertion of the pectoralis tendon. Here we can see the pectoralis tendon inserting onto the humerus. With the transducer in the long axis view, it's useful to try and see as much of the tendon as possible. Sometimes you might need to heel the transducer to make the tendon appear as horizontal as possible when you're assessing it. In situations where there's pathology, it may not be possible to see the biceps tendon in such clarity, and in such situations a wider view might be required. Here are some examples of tendinopathy and tenosynovitis of the biceps tendon. On the left, you can see that the normal architecture of the biceps tendon is lost. And then on the right, in the case of tenosynovitis, you can see that there is fluid between the biceps tendon and the sheath itself. Here's an example of a tear to the biceps tendon. On the left, in the short axis, you can see there's a hypoechogenic change within the substance of the tendon. When you flip the transducer into the long axis, you can appreciate the full extent and how big this tear is. As with other forms of imaging and radiology, you must obtain images in both views so that you can fully assess the extent of a pathology. I hope you found this video useful and it adds to your knowledge of musculoskeletal ultrasound imaging and how you can use it in your clinical practice. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. I hope to see you all very soon. Take care. Bye.